This week on ANN, the Adventist Church in Chiapas, Mexico, mourns members lost to COVID-19.
ADRA International partners with a local hospital to provide protective gear.
And later, we talk to Torben Berglund about how extended time at home is impacting our mental health.
These stories and more coming up.
Thank you so much for joining us this week.
First in the news, as coronavirus numbers spike through Mexico, the Seventh-day Adventist Church in the state of Chiapas is feeling the pain of losing hundreds of church members in recent weeks.
Adventist leaders have learned of the deaths of 275 church members believed to have succumbed to the coronavirus pandemic. Among the deceased were 2 church employees and a retired pastor.
President of the Adventist Church for Chiapas, Mexico Union, Ignacio Navarro, said, "We are going through a difficult time right now. The past 3 weeks have been the most complicated."
Navarro, together with leaders at the union office, led online memorial services for those 3 employees, honoring them for their dedicated work in the mission of the church.
79 church employees have tested positive for COVID-19. More than 4,000 are believed to be suffering from coronavirus symptoms, but many have not been tested.
Church leaders continue to hold worship services, seminars, and evangelism campaigns online, said Navarro.
The church in Chiapas has been able to assist thousands of needy Adventist families across the territory with food boxes since April, and thousands more in the community through the local Adventist Development and Relief Agency in Chiapas.
Navarro reported that each of the 8 local fields in Chiapas have distributed medical kits and medicines and have provided oxygen tanks to hospitals for coronavirus treatment.
The church in Chiapas has a physician who is coordinating with health professionals to provide medical advice to employees and members who suspect they may have COVID-19 symptoms. They are utilizing a call-in telephone line as well as video calls available 24 hours a day. Pastors have been also reminding members to continue practicing social distancing and sanitizing measures.
At the time of this recording, more than 15 million people have contracted the coronavirus. There have been 615,000 deaths and 8.9 million recoveries. Those numbers continue to grow daily.
The Adventist Development and Relief Agency, or ADRA, the global humanitarian arm of the Seventh-day Adventist Church in partnership with Adventist Community Services, recently delivered more than 20 pallets of essential medical supplies and protective gear to healthcare workers at Adventist Healthcare White Oak Medical Center in the U.S. state of Maryland. The 180-bed acute care hospital has been serving critically ill patients affected by COVID-19 in the Montgomery and Prince George's counties since the pandemic began. ADRA's president, Michael Kruger, says it is a privilege to support our nation's frontline healthcare workers. As a global humanitarian workforce, frontline work is essential in any crisis we do to aid those in need. Medical teams are among that network, and we are grateful to our partners like Adventist Community Services to help ensure hospitals in the U.S. are well equipped as they serve so many affected by this pandemic. The medical supplies worth $2.3 million in value are part of a partnership with Adventist Community Services of the Seventh-day Adventist Church in North America to support healthcare facilities in suburban areas facing severe shortages of protective supplies during the coronavirus crisis. The medical supplies include personal protective equipment such as face shields, goggles, and other essential garments for healthcare workers to reduce exposure to the coronavirus and other infectious agents. ADRA International sent this report.
At the peak of COVID-19, we were using 3,300 gowns every day.
The supply chain really got crushed early in this process. We couldn't rely on traditional ways to get supplies here in a modern country like the United States. And so to work with partners like ADRA, Adventist Community Services, to help us in this time of need has been critically important for us.
within the United States, we were able to move protective gear to the value of about $2.4 million through to various institutions and Adventist hospitals throughout the United States. We were also able to donate $150,000 to Adventist Community Services that they could stock up their food pantries in certain places around the United States.
You know, I have a 15-month-old at home. My husband, he's there. You know, I always worry to myself, what do I potentially have on me? But just knowing that there's extra supplies there brings a lot of comfort, but also just a lot of appreciation.
We were very happy, ACS in Maryland, we were very happy to connect with the right hospital, with the people that are in front lines serving the community. So that's why these partnerships are so vital and so key to make all the system and the community be served.
You came at the right time, at the right place to help. And I know that ADRA has this goal of changing the world one life at a time. And you certainly helped to change our world here at White Oak Medical Center.
The music department of the Adventist Church in Ukraine held for the first time an online all-Ukrainian music festival. The two-day event was also promoted by the Nadia TV channel. Using a psalm of praise as the motto, the event proposed new methods of glorifying God and expressing gratitude to Him, exploring new approaches to evangelism and uniting musicians from all over the country. After discussing the idea with the Advent Music Ukraine team and local music ministry leaders, they began preparing for the event. They spent 2 months studying technical issues and choosing festival nominations in several categories: quarantine choir/group, instrumental performance, solo performance, songwriter, and family performance. Despite all the obstacles and problems, they were able to make 54 compositions. The festival consisted of 2 parts, a family children's repertoire and a general music program. These were unique performances of choral groups, ensembles, and soloists. Head of music ministry for the Adventist Church in the Ukraine, Olena Nosova, says, "From the very beginning of the festival until its completion, we felt God's guidance and His presence, even in small things. We discovered many new talents and learned to glorify God in an unusual format. May the loving Lord abundantly bless all the participants of the event so that we can continue to grow and glorify His name with worthy praise."
The novel coronavirus, or COVID-19 pandemic, has forced public health officials to come up with practical and innovative solutions to end the global health crisis.
Students from Kismayo Technical Institute, a technical vocational school in Somalia supported by the Adventist Development and Relief Agency, or ADRA, since 2015, saw an opportunity to make innovative hand-washing facilities where individuals avoid direct contact with the tap and soap as water and soap are dispensed through pedaling.
Students from the Institute were able to make 50 innovative hand-washing facilities through the NORAD-funded Strengthening Equity, Access, and Quality in Education Project, or SEAQE.
In collaboration with the Ministry of Health in Somalia, the hand-washing facilities were distributed in mothers and children's hospitals, schools, government institutions and ministries, learning centers, hotels and restaurants, and the seaport in Kismayo district.
Project manager for ADRA Somalia, KB Makasoma, says these activities complement previous COVID-19 prevention works that the Ministry of Health and ADRA have done that include radio awareness messages, erecting infographic billboards, community health awareness, and distribution of information, education, and communication materials.
The 3-month COVID-19 response that started in May is supported by SEEK project and funded by the Norwegian Agency for Development Cooperation, or NORAD. The response is expected to reach over 17,000 beneficiaries in Jubaland and Banditir regional administration.
ADRA through NORAD and ADRA in Norway have been supporting Kismayo Technical Institute since 2015. Cumulatively, more than 1,700 youth and vulnerable women have been trained in vocational skills. The institute currently has 300 students and offers 6 technical and vocation courses, which include electricity, welding, carpentry, auto mechanics, and computer studies and garment making.
Coming up, we sit down with the Associate Director of Health Ministries for the Global Adventist Church to talk about mental health during COVID-19.
We'll be right back after the break.
We may look, pray, read, think, worship, sing, and share differently, but we all look forward to the Sabbath. And we all look forward to the future when Jesus will come again. With this message in mind, we arrived at a core component for a new identity system, the creation grid, a simple 7-column structure for layout. The grid is a reference both to the prophetic timeline as well as to the creation week that culminated in the 7th-day Sabbath. The first 6 columns of the grid belong to the designer. They can be filled with anything: text, images, illustrations, patterns, and logos. But the 7th column, the Sabbath column, does not belong to them. It is meant to be different and special. Regardless of what or where you are designing, you can always find information to help you communicate that we are all Seventh-day Adventists.
Welcome back.
On March 11, the World Health Organization declared COVID-19 a pandemic, and since then, as we reported earlier, more than 15 million people have contracted the virus.
With many of us entering our 5th month at home, we sat down with Associate Director of Health Ministries, Dr. Torben Berglund, to talk about how the extended time at home and the life of the pandemic impacts our mental health.
Dr. Berglund, thank you so much for joining us here on ANN today. We're so thankful that you could be with us.
Well, happy to be with you.
When you and I first talked in April, we talked about how the toll that COVID-19 might play on one's mental health, with us being inside, away from our friends and family. But none of us thought that we'd be here almost 5 months later, still at home. What is the toll that this continued time away from people might be doing to us?
Well, I think that it just makes all like the risk factors of isolation, different kind of life, lack of contact, it makes it just so much harder. And I think the aspect that really can be challenging for many and can cause a lot of stress is the fact that we don't know how long it's going to continue. Sort of we've been now for many months, more than I think most were expecting and anticipating. And in a way, there's actually there's no end in sight. That in a way is the reality that we're facing. Many parts of the world, some are doing better than others. Others are getting worse, and that is a big challenge. I think just that we don't know if you go to the dentist, sort of in 1 hour or 2 hours, I'll be out again. So it makes it bearable. When we don't know this is just like a non-stop thing, seemingly, then that makes it more challenging. And I think it makes, for those who are suffering, those who struggle to adapt, those who struggle to find ways to have their needs met for social contact, other needs met, it makes it a much bigger challenge.
Yeah, I heard on a podcast this morning that someone said from New York City that it felt like people were sort of turning in on themselves. And I've noticed like a sense of frustration and maybe loss of hope, sort of like before we were hoping that it would be next week or the next week. And now there seems to be a resignation in our circumstances and a loss of hope that compounds these other feelings that we're facing. Have you seen this as well, or do you feel like you are seeing this in people as well?
Well, I think it's always when there's a this is in a way sort of a trauma situation that we're going through, and when you don't see the end of it, then hopelessness can creep in. The thing is, it is going to end. We just don't know when, and we don't know how it will end. It will have a vaccine in a few months. Things may look very different. We don't know how this winter is going to play out. We don't know sort of it. There's so many unpredictable factors in this, and that also, of course, for people who are prone to anxiety, often anxiety is an issue of control to some extent. It's when we're trying to be in control of things that are difficult, and then this is, of course, when we have all these unpredictable issues related to the situation, that increases more anxiety. People can sort of become resignated, depressed. Very kind of people more prone to go into addiction issues, trying to cope with the stress, is because this is really a stressful situation. May not say like, well, what's the stress about it? But just the whole unpredictability and change that we're going through in radical ways, that is a major stress.
Thank you so much for that. I just want to ask you, as we wrap up this interview, what would you like to say to people right now as we're continuing to go through this? Maybe a couple words of advice, or people who may be struggling, who may have anxiety, who are maybe missing some hope or joy, who are thinking, we're looking through Christmas, we don't know. And so just to help people, as you say, we will get through it, we will end, to just something to hold on to until that happens.
Yeah. Well, I think it's the advice, that sort of general advice for how do we live life, not just letting life happen to us, but taking charge of, or like shaping our own lives. And as people are struggling, that becomes even more difficult. It's even more challenging. And that's where we also need to be sensitive to one another, and keep one another on our radars, checking in on one another. How are you doing? Is there anything I can do? And not taking no for an answer necessarily. If you have the hunch that there is something going on, or you have reason to suspect that there is something going on, like reaching out to others. And that's also, if you are the one struggling, reaching out to someone and trying to help them, that can be a very effective way of taking some of the focus off your own misery, and being kind, being caring for someone else. That's often one of the best ways for self-help. So it's a win-win in that.
Thank you, Torben, for joining us, and we're always appreciative for you to be with us, and thank you again.
Well, thank you.
Coming up, David Trim is here for This Week in Adventist History.
But up next, we hear about how the Adventist Church in Japan is reaching people with new mission methods.
Welcome back.
Global mission centers are key to the development of mission programs around the world.
Through global mission centers who focus on creating resources to share the gospel, the Adventist Church in Japan was able to start Mission Unusual.
Adventist Mission has more.
There's nothing unusual about the Adventist Church being involved in mission. Mission has always been our focus, but there is something very unusual about a new mission movement taking off in Tokyo. The church in Japan has a burden for the millions of unreached people living in their capital city. They know that without new mission methods, these people will remain unreached. So they invited the General Conference and the Northern Asia Pacific Division to partner with them to create Mission Unusual, a massive church planting and disciple making movement. Key to the development of Mission Unusual are the Global Mission Centers, which focus on creating resources to share the gospel with unreached people groups.
Today I'm in Tokyo, one of the world's largest cities. With a population of 40 million, the challenge is great before us. But guess what? Our God is greater. He has given us this mandate in Revelation 14:6 and other places in Scripture to go to every nation, kindred, tongue, and people. So how are we doing? Well, we're not home yet. And that's where we as an Adventist family worldwide can focus on reaching the unreached people groups of the city.
There's growing diversity in Japan, and the people embrace a variety of lifestyles and subcultures. This includes young people like Sunny Bunny, who use fashion as a form of self-expression. A team of church planting missionaries is already on the ground, learning the language and how best to share Jesus with the Japanese. In time, they'll start new groups of believers, who will in turn disciple others. Eventually, they'll be supported by the ministry of global mission pioneers, urban centers of influence, volunteers, and tent makers, in a concerted effort to reach the entire city for Jesus. Helping to lead this team is Pastor Nozomu Obara, the president of the East Japan Conference. For years, he's had a passion for church planting, and he and his wife Sachiko are actively engaged in a disciple-making ministry for children. Pastor Obara will be transitioning from his position as president to become the associate director for Mission Unusual Tokyo.
Greater Tokyo area is a big area with over 40 million people. But in the heart of Tokyo City, there's about 10 million people, and only 10 Adventist churches with about 900 worship attendees every week. So, one Adventist needs to reach more than 10,000 people. Tokyo is a big challenge.
To confront the challenge, Japanese pastors and missionaries will use a holistic approach to mission. Mission Unusual will plant the seeds of mission over the next 5 years. But the mission won't stop there. These efforts will continue to grow and impact people's lives for years to come.
Our focus is not just on events and programs. Building relationships and getting involved with people is our focus. Finding out people's needs and meeting people's needs. In other words, implementing Christ's method here in Mission Unusual Tokyo.
We'll keep you updated as God leads this movement and uses it for His glory. In the meantime, you too can support Mission Unusual Tokyo.
Will you join me in praying for this project as it continues to unfold over the next 5 years to uplift Jesus in this city?
Watch this and other mission stories online by visiting adventistmission.org. Then click on videos at the top.
And finally, for today's episode, let's turn to David Trim for a look at Adventist history.
Welcome to This Week in Seventh-day Adventist History. This week, we again draw from an article in the Encyclopedia of Seventh-day Adventists online. You can read more at encyclopedia.adventist.org. On July 20 in 1956, Edwin Sebastian Butts died in Warburton in the Australian state of Victoria at the age of 92. Butts had been born on September 2, 1864 in Macon County in the U.S. state of Illinois. At the age of 23, he was baptized into the Seventh-day Adventist Church and within 2 years was working as an evangelist for the Illinois Conference. He attended Battle Creek College and was then called to work in the San Francisco Bay Area. And on June 2nd, 1892, he married Florence Davis at St. Helena Sanitarium, just north of San Francisco. Florence was a native of Iowa, born to Adventist parents, and at an early age, she decided to become a nurse. She trained at St. Helena Sanitarium, and almost certainly that was where she met Edwin. Their first daughter, Edna, was born in March 1893, but sadly died less than 2 years later. However, a sister, Alma, followed in 1894. In this photograph, you see Edwin, Florence, and little Alma. A year later, at the 1895 General Conference session, Edwin and Florence were appointed to serve as missionaries in the islands of the South Pacific. Edwin was just 30 years of age, Florence 27, and Alma only a year old. But on May 1st, 1895, the young family sailed from San Francisco. They served initially in Pitcairn Island, then for 10 years in the island nation of Tonga, and subsequently across Australia and New Zealand. Here you see a photograph of Edwin and Florence in later life. Edwin served at various times as president of the South Australian, Tasmanian, Queensland, West Australian, and North New Zealand conferences. And he also worked as a pastor in the states of New South Wales and Victoria in Australia. Edwin and Florence also served for several years on the faculty of Australasian Missionary College, today's Avondale College. And later, when their daughter Alma grew up, she went as a missionary herself. She married a young Australian pastor, Norman Wiles, and they served for several years in the New Hebrides, today's nation of Vanuatu, where, sadly, Norman died. Alma, though, went on to mission service in Papua New Guinea and later in Nigeria. This was a family completely committed to the prophetic mission of the Seventh-day Adventist Church. And we have skipped over many stories. There is so much more to say about Edwin and Florence, and of course about little Alma, who grew up to be a missionary herself. You can read their stories and thousands more at encyclopedia.adventist.org. That website again, encyclopedia.adventist.org. That was This Week in Adventist History.
Thanks for watching ANN. Join us next week for more news from around the global Seventh-day Adventist Church.
We'd love to hear from you. Send us your feedback and tell us how your church is making a difference in its community.
Be sure to capture plenty of video footage and photos, then write up a summary of the event's important details. And feel free to send full video reports as well.
You can reach us by sending an email to annvideo11@gmail.com.
Before we say goodbye, here's some good news from the book of Jude, chapter 1, verses 24 and 25.
Passage says, "Now to him who is able to keep you from falling, and to present you blameless before the presence of his glory with rejoicing, to the only wise God, our Savior, be glory and majesty, dominion and power, both now and forever. Amen."
That's our program for this week. And remember, you can always visit Adventist.news for daily news and videos. Until next time, God bless.
Take care.